I knew that my breathing was deteriorating enough that I needed to get myself somewhere. So we presented at the emergency department at 3:30 in the morning and went from there.
You know, stories like that are common as more people are going to the hospital right now for treatment for COVID-19. 41 Action News reporter Sarah Plake explains how hospitals across the metro are handling the increase in patients.
St. Luke's Hospital and many other hospitals in the metro are struggling with capacity issues. They say they don't want to scare the public, but we talked to a doctor at St. Luke's who will explain this so that people better understand what the hospitals are dealing with. About 11% of patients, or about 80 people at St. Luke's Hospital, have COVID-19.
We're seeing about a third of our patients that come in with COVID-19 do end up staying in the ICU at some point in time. So that really takes up a bed for a long period of time where we can't turn those patients around as long, and that further cuts into capacity.
Earlier in the week, St. Luke's was on diversion for a short amount of time, which happens at every facility. This means they weren't accepting ambulances except for issues like heart attack and trauma. Dr. Mark Larson says this happens for an hour or so to get beds prepped and open.
I do want to reassure the public though we're bursting at the seams, we will always be there to take care of you.
Compared to last October, St. Luke's ICU capacity is up 20%, and the length of time someone is waiting for a bed in the ER is up 77%. On those nights when the ER is overflowing, doctors say they will still find a way.
We'll go downstairs to the preoperative unit and we'll take ER patients down there because we need to have a physical space where we can care for these patients.
University of Kansas Health System doctors stress there will always be a place for patients to go.
We do work with other ICUs around the city. We, again, meet every week or every 2 weeks. We'll continue to do that and make sure that we have capacity and coordinate as a team as we need to.
I do worry about what's potentially coming down the pipe with the flu seasons getting ready to start. We're seeing hospital capacity similar to what we see in the peaks of flu season, and we are just starting to see influenza.
Sarah Plake, 41 Action News.